Hello everyone. We are from group 4 of BSN 1L and today we will discuss about the drugs and abbreviation. First is the drug. Number 1 is the angiotensin converting enzyme inhibitor or ACE. They are the medicines that help relax the veins and arteries to lower the blood pressure. They also work by blocking the conversion of the angiotensin II. What is angiotensin II? Angiotensin II is a substance that constricts blood vessels and stimulates the release of aldosterone. Next is the angiotensin receptor blocker. They are the medications that block the angiotensin II by binding to its receptors in various tissue. Primary use. The angiotensin blocker includes the treating patients who have a hypertension and managing certain heart condition. Next is the antiarrhythmic agent. What is antiarrhythmic agent? These are the medications designed to regulate the rate and rhythm of the heartbeat. They also manage the abnormal heart rhythms known as the arrhythmias, which involve the heart beating too fast or too slow. Next is the beta-adrenergic blocking agent. They are also known as the beta blockers are medications that work by blocking the effects of the hormone epinephrine on beta receptors. They can be found in the heart and part of the sympathetic nervous system. Next is the calcium channel blocker. Calcium channel blockers are medications that regulates the rate and force of heart contractions by controlling the entry of calcium into the heart muscle cells. They also use to block calcium channels which are responsible for allowing calcium ions to enter the cells of the heart and smooth muscles. Next we have is the digitalis. Digitalis, these are the medications from the foxglove plant. What is foxglove plant? These are contained compounds of drugs belong to a class known as cardiac glycosides and used to slow the heart rate and strengthen the contraction of the heart muscles. They also work by inhibiting the sodium-potassium pump in the heart cells, leading to increase in intracellular calcium. Next, we have the diuretic. What is diuretic? Diuretic increase the production of urine by the kidneys, leads to the removal of excess sodium and water from the body. They also reduce the volume of fluid in the bloodstream, which subsequently lowers blood volume and decrease the workload on the heart. Next is the hypolipidemic agent. Hypolipidemic agents, these are the drugs that work on the lower levels of lipids, particularly cholesterol, in the blood. They also manage and reduce elevated cholesterol levels associated with an increased risk of cardiovascular diseases.
Next is lidocaine, a local anesthetic that is used intravenously to treat cardiac arrhythmias. It is also known as lignocaine. It also has analgesic uses and can be used as an adjunct to treat tracheal intubation. Now let's move on to loop diuretic. It is a drug that increases urine output by inhibiting electrolyte reabsorption in the kidney nephrons or loops. They are primarily used in medicine to treat hypertension, often due to congestive heart failure or chronic kidney disease. The most commonly used loop diuretic drugs are furosemide, bumetanide, and torsemide. Next is nitroglycerin. It is a drug used in the treatment of angina pectoris to dilate coronary vessel. It prevents and treats chest pain by relaxing your blood vessels. Next is statins, also known as hydroxymethyl coenzyme A. It is a drug that act to lower lipids in the blood. The drug names end with statins such as lovastatin, pravastatin, or atorvastatin are considered as cholesterol-lowering drugs. These two are used to dissolve blood clots. The difference is streptokinase is an enzyme used to dissolve blood clots while tissue plasminogen activator from the word activator, it is a drug used to dissolve blood clots. It activates production of a substance called plasmin in the blood that normally dissolve clots. And lastly is vasodilator. It is a drug that widens blood vessels and improves blood flow. And now let us move on to the abbreviations. First on the list is ACE or angiotensin converting enzymes. It is a central component of the renin-angiotensin system which controls blood pressure by regulating the volume of fluids in the body.
An AED or automated external defibrillator is used to help those experiencing sudden cardiac arrest. It's a sophisticated yet easy to use medical device that can analyze the heart rhythm and, if necessary, deliver an electrical shock or defibrillation to help the heart reestablish an effective rhythm. Atrial fibrillation. Atrial fibrillation happens when abnormal electrical impulses suddenly start firing in the atria. These impulses override the heart's natural pacemaker, which can no longer control the rhythm of the heart. This causes you to have a highly irregular pulse rate. Next is acute myocardial infarction. Acute myocardial infarction is myocardial necrosis resulting from acute obstruction of a coronary artery. Symptoms include chest discomfort with or without nausea and diaphoresis. Diagnosis is by electrocardiography, ECG, and the presence of or absence of serologic markers. Atrial premature complex. A premature atrial complex is a premature beat arising from ectopic pacemaking tissue within the atria. There is an abnormal P wave usually followed by a normal QRS complex. Aortic regurgitation. Aortic regurgitation allows some of the blood that was pumped out of the left ventricle to leak back in. As the left ventricle works harder to keep pushing blood through the aortic valve, it may eventually become enlarged and weakened. A weakened left ventricle may lead to heart failure. Next, angiotensin receptor blocker. Angiotensin receptor blocker, also known as angiotensin II receptor antagonist, are used to treat high blood pressure and heart failure. They are also used for chronic kidney disease and prescribed following a heart attack. Aortic stenosis. Aortic stenosis occurs when the aortic valve narrows and blood cannot flow normally. The condition may range from mild to severe. Over time, aortic valve stenosis causes your heart's left ventricle to pump harder to push blood through the narrowed aortic valve. Arteriosclerosis. Arteriosclerosis is a type of vascular disease where the blood vessels carrying oxygen away from the heart become damaged from factors such as high cholesterol, high blood pressure, diabetes, and certain genetic influences.
The abbreviation for atrial septal defect (ASD) is derived from the medical term for this condition. Atrial refers to the two upper chambers of the heart, known as the atria, and septal refers to the wall or septum that separates the left and right atria. Defect refers to a hole or opening in the septum which allows blood to flow between the two atria. Therefore, ASD is an abbreviation for atrial septal defect, which describes the medical condition of a hole or opening in the septum between the left and right atria of the heart. Next, the term arteriosclerotic heart disease (ASHD) refers to a type of heart disease caused by the buildup of plaque or arteriosclerosis in the arteries that supply blood to the heart. The term arteriosclerosis comes from the Greek words arterio, meaning artery, and sclerosis, meaning hardening or thickening. The abbreviation ASHD was likely created as a shorthand way to refer to this condition, as it is a lengthy and somewhat cumbersome term to say repeatedly. The acronym ASHD is commonly used in medical and scientific literature as well as in healthcare settings to efficiently communicate this diagnosis. Let us now move on to the next abbreviation, which is the AT or the atrial tachycardia. The term atrial tachycardia itself comes from the medical field and refers to a type of heart rhythm disorder in which the heart's atria or upper chambers beat too rapidly, typically at a rate of more than 100 beats per minute. The term tachycardia means rapid heart rate while atrial refers to the atria. The abbreviation AT is commonly used in medical records, reports, and communication between healthcare providers to quickly and accurately convey this diagnosis. Next one, the abbreviation AV in medical terminology stands for atrioventricular. The term atrioventricular refers to the anatomical structure that connects the atria or upper chambers of the heart to the ventricles or lower chambers. Specifically, it refers to the AV node or atrioventricular node and the AV bundle, which are located between the atria and ventricles and play a crucial role in regulating the heart's electrical activity. The AV node acts as a natural pacemaker, ensuring that the ventricles contract in a coordinated manner with the atria. The AV bundle then transmits electrical impulses from the AV node to the ventricles, causing them to contract. The abbreviation AV is commonly used in medical. Let us now proceed to the next term, the bundle branch block or BBB. BBB is a medical abbreviation used to describe a condition in which the electrical impulses that normally travels through the heart's bundle branches are partially or completely blocked. This can lead to a delay or disruption in the normal electrical activity of the heart, which can result in an abnormal heart rhythm or reduced heart function. The term block refers to the obstruction or delay in the electrical impulses passing through the affected bundle branch. The specific location of the block is indicated by the prefix left or right before the term bundle branch block. The use of medical abbreviations like BBB helps healthcare providers to communicate quickly and accurately about complex medical conditions and treatments. Next, the abbreviation for blood pressure (BP) is derived from the medical term blood pressure. The term blood pressure itself comes from the medical field where it refers to the force of blood pushing against the walls of the arteries as the heart pumps blood. The term pressure is used because it describes the force that is applied to an object, which is in this case the walls of the arteries. Next, the abbreviation BPM or beats per minute comes from the musical term tempo, which refers to the speed or pace of a musical composition. In the 1980s, as electronic dance music or EDM began to gain popularity, DJs and producers started using metronomes and drum machines to create precise and repetitive beats. They needed a way to communicate the tempo of their tracks to other musicians and DJs, so they started using the abbreviation BPM to indicate the number of beats that occurred in 1 minute. The term beats per minute became widely adopted in the EDM community and is now commonly used in all genres of music. Next in the line, the abbreviation for coronary artery bypass graft or CABG. CABG comes from the medical procedure itself. Coronary refers to the heart's coronary arteries which supply blood and oxygen to the heart muscle. Artery refers to the type of blood vessel involved and bypass refers to the surgical technique used to reroute blood flow around a blocked or narrow coronary artery, bypassing the blocked or narrow section. Then graft refers to the new blood vessel that is used to bypass the blocked or narrowed section of the coronary artery. So, CABG is an abbreviation for the surgical procedure that involves bypassing a blocked or narrow coronary artery using a grafted blood vessel.
CAD or coronary artery disease is a blockage of coronary arteries. CCU or coronary cardiac care unit is a hospital ward specialized in the care of patients with heart attacks. CHD is coronary heart disease, the term that describes what happens when the heart blood supplies is blocked. CHF is congestive heart failure. a serious condition in which the heart doesn't pump blood as efficiently as it should. CKMB or creatine kinase MB, also known as creatine phosphokinase or phosphocreatine kinase. CPR, also known as cardiopulmonary resuscitation. CRP, C-reactive protein. CTA or computed tomography angiography is the visualization of arteries and veins.
Cerebrovascular accident is an interruption in the flow of blood to cell in the brain or mas kilalang brain attack or stroke. Ito yung pagkakaroon ng blood clot o pagbagsak ng dugo sa utak. Next is cardiovascular disease. Is a broad term that encompasses condition affecting the heart and blood cells, or a group of disorder of heart and blood vessel. For example, this is hypertension, heart failure, diabetes, and excessive weight. It is the leading cause of death globally. Chronic venous insufficiency or CVI. It is a condition in which veins have problem moving blood back to the heart, or also known as chronic venous stasis flavitis or post-thrombotic syndromes. Ito yung pananakit ng binti, pamamaga. Central venous pressure or CVP is a measure of pressure in the vena cava, can be used as an estimation of preload and right atrial pressure. CVP is an important indicator monitored in medical setting, providing insight into a patient fluid status and cardiac function. It reflects the amount of blood returning to the heart, pump blood into the heart, and the ability of the heart to pump blood into the arterial system. Dyspnea on exertion or DOE. It is a difficulty or discomfort in breathing that occurs during physical activity or exertion. Deep vein thrombosis or DVT. Deep vein thrombosis is a condition characterized by the formation of blood clots in the deep vein, usually in the legs. Electrocardiogram or electrocardiography or ECG. It is a medical test that records the electrical activity of the heart over a period of time. It's commonly used to diagnose heart problem by measuring the heart's rhythm and detecting any irregularities or abnormalities. High density lipoprotein or HDL. It is a good cholesterol. It is a play of crucial role in carrying cholesterol away from the arteries to liver, where it can be processed and eliminated from the body. Higher level of high-density lipoprotein are generally considered beneficial for cardiovascular health as they contribute to reducing the risk of heart disease.
Number 1, IABP or the intra-aortic balloon pump. Intra-aortic balloon pump is a medical device used to provide temporary mechanical circulatory support for the heart. It also involves a balloon inserted into the aorta, which is the largest artery in the body, through a catheter. For example, is the Datascope CS300. This is used in hospital to assist the heart during surgeries where heart is struggling to pump blood effectively. Next is the LAHB or the left anterior hemiblock. Anterior hemiblock, or also known as the left anterior fascicular block, is a condition characterized by delayed in one of the branches of the left bundle branch of the heart's electrical system. Next is the LDL or low density lipoprotein. Low density lipoprotein, it transports cholesterol and triglycerides from the liver to cells in the body. This is also referred to as the bad cholesterol, which is in the bloodstream, one associated with an increased risk of atherosclerosis and cardiovascular disease. Next we have is the LV or the left ventricle. Left ventricle is the one of the four chambers of the human heart and responsible for pumping oxygenated blood to the rest of the body. For example, is pumps oxygenated blood into the body, supplying vital nutrients and oxygen to tissues and organs. Next, we have the LVAD or the left ventricular assist device. Left ventricular assist device is a mechanical pump implanted in the chest to support the pumping function of the left ventricle of the heart. It also helps circulate blood throughout the body, providing assistance when the heart is unable to pump adequately on its own. Next, we have the LVEDP or the left ventricular and diastolic pressure. Left ventricular and diastolic pressure refers to the pressure within the left ventricle of the heart at the end of its relaxation phase known as the diastole. This measurement is an important indicator of how well the left ventricle is filling with blood before it contracts to pump blood into the systematic circulation. Next, we have the LVH, which is the left ventricular hypertrophy. Left ventricular hypertrophy, it is a condition where the muscle of the left ventricle of the heart thickens, often as a response to increased pressure overload. The thickening can also affect the heart's ability to pump blood efficiently. Next, we have the MI or the myocardial infarction. Myocardial infarction, known as the heart attack. What is heart attack? Heart attack occurs when blood flow to a part of the heart muscle is blocked, usually by a blood clot. This blockage leads to the death of the heart muscle tissue due to the lack of oxygen.
Mitral valve prolapse. A prolapsed mitral valve means that the valve flaps do not always fit and close properly between each beat of the heart, which may cause the valve to leak blood backward throughout the valve back to the left atrium. This condition is called mitral valve regurgitation. Mitral valve replacement. The mitral valve lies between the left atrium and the left ventricle. Your doctor will replace your poorly working mitral valve with an artificial valve. This will ensure the blood can flow into the left ventricle and then flow out to the body normally without putting extra stress on the heart. Merong dalawang uri ng pangunahing ng mitral valve replacement, ang mechanical at biological. Ang mechanical valves ay gawa sa materyales tulad ng metal at carbon, samantalang ang biological valves ay maaaring ito'y mula sa tissues ng hayop o donasyon ng tao. Ang pagpapalit ng mitral valve ay isang komplikadong operasyon at karaniwang ginagawa sa mga kaso ng severe mitral regurgitation o stenosis. Pagkatapos ng surgery, mahalaga ang maingat na pagsusuri at pagsunod sa mga direktibo ng doktor para sa tamang recovery at pangangalaga sa kalusugan. Point of maximal impulse. The point of maximal impulse, known as PMI, is the location at which the cardiac impulse can be best palpitate on the chest wall. Frequently, this is the fifth intercostal space at the midclavicular lane.
PSVT or paroxysmal supraventricular tachycardia describes a narrow complex tachycardia involving episodic supraventricular tachycardia with sudden onset and termination. In contrast to multifocal atrial tachycardia, atrial fibrillation, and atrial flutter, PSVT involves a regular ventricular response. PVD or peripheral ventricular disease is a systemic disorder that involves the narrowing of peripheral blood vessels. This happens as a result of arteriosclerosis or a buildup of plaque and can happen with veins or arteries. SVT or supraventricular tachycardia is a condition where your heart suddenly beats much faster than normal. VLDL or very low density lipoprotein is a cholesterol produced in the liver and released into the bloodstream to supply body tissues with a type of fat. VSD, or ventricular septal defect, is a birth defect of the heart in which there is a hole in the wall that separates the two lower chambers of the heart. VT, or ventricular tachycardia, is a type of abnormal heart rhythm or arrhythmia. It occurs when the lower chamber of the heart beats too fast to pump well and the body doesn't receive enough oxygenated blood. That concludes our discussion about drugs and abbreviations.